Hi, Dr. Dave Webster, and welcome back to my case scenario pages, and yet another victim of the Ontario government's use of evidence-based medicine to block and restrict access to PET in this case. But remember that it isn't just PET that they're restricting access to. This government is clearly moved into the position of blocking access to healthcare in general. So this is a patient who had a CT back in early April, which showed some very concerning findings for some fairly extensive lung cancer in the patient's chest. And on these images here you can see those abnormalities I pointed out with the arrows here in the left chest. This is all abnormal. This patient then went on to have a biopsy which proved this to be lung cancer, and finally gets a PET scan by the end of June. Now, here is the PET scan image. This is the whole body image here, and there's a number of abnormalities on here. The first abnormality shows you the extensive black areas in the left chest here. All of this is going to turn out to be cancer. We also know from the degree of uptake on this image here that it's a very aggressive cancer as well, period. Sorry, sounds like I'm dictating here. I'm used to dictating these reports. I apologize. Anyway, but in addition, and this is why the rest of the world does exactly the opposite of what the evidence-based medicine people working for the government concluded. You'll notice that, for example, in the right chest here, look at this image here, there's a very abnormal area of uptake around this rib. Now, there's other things that could be. It certainly doesn't look like a fracture. It certainly is very, very concerning for a site of metastatic disease. And what is important about this is two things. Firstly, if this is distant metastasis, then this patient unfortunately has what we call stage 4 disease, which simply is not going to be potentially curable, and so this patient could only ever be offered palliative therapy. But secondly, and again what PET demonstrates and why people do in the rest of the civilized world beyond Ontario would have done the PET scan first, is that you could have, in a much safer way, done a biopsy of the tissue surrounding that rib. That would have been a very simple thing that could have been done virtually in the doctor's office under local anesthetic, and almost certainly would have been a metastatic disease, and if that was the case, then the investigation would have been finished. Instead, in this patient, went on to have 2 more CTs. One was a diagnostic CT and another one was a biopsy CT. And the thing to remember is the patient had lots of radiation exposure from these completely unnecessarily. Not that it'll make any difference to the long-term survival of this patient, but when you look at the patient went through these procedures, the anxiety the patient's going through, and then very clearly the risk of a completely unnecessary biopsy in through this patient's chest, which the patient could have died from the biopsy itself. So the rest of the world would have done the PET scan first and then went to an area where tissue was much easier, much safer to get access to. It may not have been cancer, and then you would go to the next area to look. But in addition, this scan demonstrates other things that are obvious on PET. If you look up in the neck here, there's a very abnormal focus sitting in the patient's right side of the bottom of their throat here. And this is very concerning for a cancer in the the throat here, in what we call the pharynx, where this is not known yet. Now, if you look on our CT images, there is a small mass in this area. Again, it could be other things, but certainly very, very, very concerning for a cancer. And now we'll look in that. And again, if this patient had had the PET scan first, we would have done all of this beforehand. And now we will look into this patient's finding here. And it is not uncommon that patients with lung cancer who are typically smokers have a second cancer with throat cancer. Vice versa, when we're looking at patients with throat cancer, we often find an unsuspected lung cancer. So again, the rest of the world, admittedly, they're not using Ontario's, fabulous evidence-based medicine approach to decide what's the most appropriate uses of PET. So I guess they're at a disadvantage there. But maybe their purpose is not to block patients from access to care. Maybe, Anyway, the bottom line is that in addition, there are actually some other findings in this scan, which are more subtle, but certainly concerning, and that is in the right hip. Here you'll see there's a very small focus of bone tracer uptake here, which is sitting in an area which is concerning for metastasis. So again, just to summarize, you know, this person's in the splatter zone of the government's, you know, the governments of Ontario's efforts to block access to healthcare using their cherished evidence-based medicine, which is the perfect, you know, tool that governments can use to dial in the answers they want, to get the policies they want instituted. So this patient, you know, I mean, this was early April. We could have had this patient in for a PET scan right away. We would have had a much safer process to approach this patient without the risk of the central, you know, needle into their chest. You look at my other video and see what just kind of a needle they have to stick in these people's chest. This patient could have been handled much simpler, much faster, and found the proper answer first. Potentially found a second cancer that they didn't even know about. But of course they live in Ontario, don't they? So yet again, I can't encourage you enough to not just respond about the PET. I mean, this is simply another example of Ontario government healthcare, and you need to be worried if you're going to ever be a patient in this province. So if you know someone with cancer, if you have cancer yourself, use the website. Do not let up on these people until they explain exactly why they're coming up with conclusions that the exact opposite of the rest of the world using their cherished evidence-based medicine. Thank you.